Welcome back to another Wellness Wednesday here at Spine and Rehab Specialist. I'm Earl Hayden, one of the physical therapists here, and then this is Chris helping me demonstrate some of these exercises again. So last week we talked about exercises that you could do to warm up before playing a baseball game, but kind of building up on that, it's important to make sure that we're taking care of the shoulder. So we're going to go over some different exercises that can help you develop some of the more neglected muscles that we often see that patients are missing strength on, and that can definitely help you take care of your shoulder for the long term. So the first exercise that we're going to go over is called an internal rotation walkout. We're using a sports cord here for resistance. These are great, but you can also use a band if you don't have access to one of these things. So all Chris is going to do here, he's going to keep his elbow tucked against his towel right here and keeping his hand right in front, and he's just going to take some steps out to the side. So we're working on a couple of muscles that are deep in the shoulder. So we're trying to target the rotator cuff. The rotator cuff are 4 small muscles that surround the head of the bone in the joint to give you all the stability you need to successfully move that arm up overhead, across the body, behind your back. And these muscles are often neglected with a lot of traditional training. So the next exercise we're showing here is almost the same concept, but this is for another part of the rotator cuff. So this is an external rotation walkout or external rotator walkout. So again, he's just stepping out from the side, making sure that his hand does not move from this spot, okay? And he's doing really good right here, keeping good technique. Posture is great, which is perfect because we are in a therapy clinic after all. Once you feel good with doing the walkout exercises, you can change this up and make this more of an active exercise for the shoulder. So instead of just holding in one spot, you can actually actively rotate through the motion. So I would recommend starting with the walkout exercise if you're having pain, if you're still having a lot of weakness, because again, these muscles are often missed with normal training practices. And now Chris is demonstrating the active internal rotation with the sports cord. You notice here, we got this little towel, this little roll of towels underneath his arm. All this does is increase the activity of those particular muscles. There's another version of this exercise, specifically the external rotation, that we can do that doesn't require a towel, and it's probably, it doesn't require like any equipment really, and it should be challenging for most people. So this next exercise is side-lying external rotation. So this one is almost the same motion as what we're doing with the cords, but the difference is, one, we're laying on the side. So he's lifting his hand directly up against gravity. So that alone already adds a lot more resistance than you would get with the cord. If this is too easy, if you feel like someone's just kind of breezing through this movement and they're about to pop a wheelie here on the table, then what you can always do is add a little weight. So here, I'm just adding about a 3-pound dumbbell here. And you don't need a lot of weight for this exercise. I'm happy if some folks can maybe do this for maybe 5 pounds, okay? You want to do high repetitions, anywhere between 10 to 20 repetitions. So now the thing that you should have noticed with all these exercises, we haven't done anything overhead yet. Okay, so I like to start with folks doing a lot of these exercises below shoulder level, making sure everything's nice and strong here, make sure we built up the stability and the endurance of those muscles. Once you've done that and you have someone that can successfully go overhead and not have any issues, the next thing you do is we call it swimmer progressions, also known as a Serrano press, depending on who you ask. So all Chris is going to do, he's going to pull, he's going to turn up, and then he's going to go up again, okay? Maintaining the good squeeze between the shoulder blades. This is actually a really challenging exercise for most folks. A couple of things that we typically see is when people are pulling back, maybe they don't squeeze back all the way, or definitely as they rotate back, you see them as they start to press up, their arms start to drift forward. So Chris is doing awesome here, keeping his hands back and showing us the technique of a pro. All right, so this next exercise is called a perpendicular press or a Pallof press, depending on who you ask once again. The importance of this exercise is, one, it builds up the strength of the core and also ties it in with working on the stability of the shoulders. Because again, when we're using our arms, doing any type of activities around the home, we're playing any sport, our limbs are not just working by themselves, they're always working in coordination with the rest of the body. So all Chris is going to do here, he's going to get a little squat, keep his hands together, and he's just going to press out in front of him and then come back nice and smooth. Main thing we're looking for is that his hands are not drifting off to the sides. He's pushing to the front and coming right back. You can make this more challenging by either making the hold a little bit longer, okay, or doing this with one arm. There we go. Or keeping the arms out there and adding a little side step. So once you've done all of those exercises, you want to challenge your client or patient or athlete a little bit more. You want to get them moving a little bit more. You can add in a kettlebell. So this is a kettlebell up walk. What we're looking for is the elbow and the shoulder should be lined up, and he's keeping that bell up, gripping that thing super tight. And then he's just gonna walk. We're looking for keeping the elbow up. His arm and weight should not drift to either side. And then we just take a stroll through the clinic. Doesn't take a lot of weight for this exercise. You want to start off light, making sure that they have good control, because you don't want them to accidentally have that belt slip out of their hand and have them drop in on their foot or hit their head. So now the next exercise we're doing is the full waiter walk. Again, the bell is held up and Chris is just gonna walk in this position, okay? So what we're looking for is, again, that bell is up, the arm is perfectly up. It shouldn't be drifting to the front, shouldn't be drifting too far back. He's maintaining control, keeping the abs nice and tight while he's doing this exercise. It's a good core workout. Again, it's a good way to challenge the stability of the shoulder. If you can do this with control, with a decent amount of weight, you're kind of be set for a bunch of different activities and sports. And those are a good variety of exercises you can use to develop the rotator cuff, which is important for everyday activities, whether you're trying to pick up something from the ground, push something up on a shelf that's overhead, or if you want to play any type of sport, whether you're pushing, throwing, hitting. All these muscles are important to maintain, and really it doesn't take a lot of equipment to do it. So if you want to learn more about these exercises or anything else you can do to take care of the rotator cuff, come and join us. We're having a free workshop on June 23rd at 7 o'clock here at our Edgemere location. If you want to learn more, please click on our link tree, which is right up top in our bio, and it has more information about the workshop and has information on how you can register for it.